Well, good morning, everyone. How are you? Good. See? All right. Y'all had good home training. You said good morning back. I love it. I am so delighted to be with you this morning for a few reasons. One is I got to wake up and talk to a group of experts this morning at this table over here. These experts around the experience of being a young person in 2023. Now, how many adults in this room, if I gave you $1 million, would go back to middle school? Oh, okay. $1 million did it for 3 people, 4, right? The young people in this room are not only experts, but are like doing some things that I don't think many of us could do, which is persevere, be resilient, and have a willingness to have a conversation around mental health that no one of us might have had that experience 20-some years ago, 30-some years ago, or more, right? And so we're so excited to have a conversation with you today about something that I think AIM is providing that is that safe space for young people to have a conversation, but not only just have the conversation, to lead the conversation as they are the leaders that are taking over for us now and in the future. The conversation in our country is happening, and it's also happening in this room. And so I have a question for all of you, if you want to take a few moments. What is one thing that you heard at the conference thus far that will help to change the narrative about mental health and substance use? And so I have an assignment, and I have a few of them throughout our time together this morning, and I hope it's going to be a dialogue. Y'all are going to have to talk back to me. I was raised Baptist, okay? So it's important to hear, you all had that conversation, because that conversation can carry from what we start today, what AIM has started years ago and continues to do, and then carry us into the future. So think about just the last 24 hours. What's something that you heard that can kind of change this conversation, something that kind of sparks something for you? Go ahead and talk about that for a couple minutes at your tables. So anyone want to volunteer maybe a summary of what you heard during that brief discussion before I voluntold you? Any volunteers? Anyone want to volunteer before you get voluntold? All right. And what's your name? Colin. Colin, tell us, I'm going to give you the mic, tell us a little bit about a summary. I'm going to hold on to the mic. Okay.
So we were talking about how about naming feelings could be a powerful tool to help people notice their relationship with substance use or things like that.
So naming feelings. All right. And we know Dr. Mark Brackett was talking about those feelings in the ruler, right? Absolutely. Anything else that folks have, a burning thing they want to bring into the room? Yes, Joanna.
So we were talking about how the results from the survey, the youth survey yesterday, really, I had a light bulb moment around just we need to train other youth to be able to talk so they can talk to each other.
I'm going to send you your $20 in the mail. You set me up perfectly. Thank you. All right. Someone else. One more. Something you heard that kind of sparked something for you yesterday? Yes. What's your name?
Amit Bandel. Our group really talked about just validation and active listening. I think that's most important for our teens, and then moving into the problem solving, right?
Love it. So that distinction between being able to kind of recognize something is there, but not try to swoop in and fix, right? Not try to swoop in and fix. All right, can we give those volunteers that were not voluntold a hand, please? Awesome. I think one of the things that what resonated with me yesterday is that we all know the challenge that exists, right? We heard it in so many ways. We heard some of the things that folks were experiencing, young people were experiencing, and knowing the 1 in 5, as you walked up the escalator, you saw that number, right? We know about the young people under the age of 18 who might be diagnosed with a psychiatric disorder are over 17 million, right, in our country. What we also know is that 75%, 2/3 of mental health challenges, they develop before the age of 14. That's also something that we've heard and we know. We also know that the risk around suicide is increasing, so I don't need to tell you those things. We heard about that. But help-seeking behaviors is something that I think is interesting. Mental Health First Aid was founded in Australia more than 20 years ago by a person with lived experience, someone who was a CPR and first aid trainer, but understood that her own psychiatric or mental health challenges were getting in the way, and thought that there might need to be a program that would help connect the dots for folks in the same ways that CPR and first aid can be life-saving, right? And so it's interesting to see that in other parts of our world, folks are seeking help. Now, that's for a myriad of reasons, right? Healthcare systems, availability of services, different types of impacts. But here in the US, the numbers almost flip the opposite direction. And so mental health first aid is one way that we want to start to connect the dots between those conversations. And although we know what the numbers show us, and we've heard that throughout our time together over the last few days, it has been really illuminating to hear these conversations. We also know it doesn't have to be this way, right? And I heard so much hope in the conversations that existed. I heard so much hope in the conversations that we'll have, you all were having this morning. But also we know that research demonstrates that when someone has the information necessary, they are more willing to act. That's decreasing social distance. Now that phrase, I will tell you, social distance, 4 years ago, if I said it, no one would know what the heck I was talking about, right? Now, we all know what that means and what that does in the sphere of mental health and well-being. As we talk about really addressing stigma, we know that stigma is reduced when we decrease that social distance. And for the first time, a couple years ago, some research demonstrated that we actually are moving the needle. We talk about that, right? That phrase, and what does it really mean? More people are willing to have a conversation today than they were before. Would you all agree with that, right? But is it enough, right? Not enough people are willing. And we're glad that we started this process, but one of the things that I am grateful for is that what we see when we implement something like mental health first aid, and I'll talk about a few examples of what that looks like, we see people demonstrating increased wellness themselves, right? Making sure that they're aware of how to help somebody else, but in that altruistic outreach, they're also finding themselves more aware of their own challenges and more willing to go and seek support for their challenges, right? And so that's some of the things that we'll talk about today. So who the heck am I? Where did I come from? Well, I'm West Philadelphia born and raised, like Will Smith. But I also work for the National Council for Mental Wellbeing. And that organization has been around for a long time. More than half a century. And that organization is really focused to support our nation's most vulnerable people. What I mean by that, I mean people who are receiving mental health and substance use services from the community and are typically being supported because they don't have insurance or are not employed or are having some challenges when it comes to making resources available for them and their families. And so what we do is not only support folks by giving them information with our public education programs like Mental Health First Aid, but we also are advocates. We're making sure that things like certified community behavioral health centers exist, making sure they're funded, advocating at the state and the federal level for more dollars and more support for things that allow our communities to be well. Right? In addition, we also represent 3,200 member organizations that provide those services to more than 10 million individuals across the country. And one of the things we've heard resoundingly from our members, from the folks who were also on the front line of the global pandemic, who also had the perspective of state funding being cut and challenges that they've had financially to kind of keep treatment happening within communities, that the distress call is heightened, right? Folks are needing services, needing more really significant services, and coming in to their doors with a higher level of need and higher level of symptoms, and that lack of hope that is identified. And I am so hopeful because there's people in this room who came here today who are already making such an impact by taking time, because that's the only non-renewable source that we have. And you've taken the time to be here and to be part of this conversation. And you as youth are leading this conversation and leading us in good directions. And I can't wait to talk about that a little bit more. What if I asked you 4 years ago what 988 was, would you know? Right? But it's actually been in process for a long time. And we know that that long number, 800-273-TALK, right? That number used to be the suicide prevention lifeline, and the lifeline is now 988. Now, these are some of the ways in which we're trying to change how we create more access and awareness. And I mentioned CCBHCs. Certified Community Behavioral Health Centers is another way that we're trying to create more access. That's the National Council's work overall. We've been involved with both of these initiatives. But another way that we're trying to create access is making sure that people are aware, right? I have a question for you. If you were to see an accident, right? If you were to see an accident, how many of you would do something? Go ahead and put your hand up. Or let me know in some other affirmative way that you would do something, yeah? And this is not that you all drive, interestingly, on this side of the country. I'll just talk about the East Coasters, okay? So we would be willing to do something. Okay, how many of you would be CPR trained and are willing to go and perform CPR? Okay, fewer hands, but still a lot of folks. Okay, great. How many of you would be willing to call 911? If you saw okay, great. All right. How many of you would be able to perform a tracheotomy? One human in the back. Thank you. Right? So all of us would be willing to do something, but not all of us would know how to do everything, right? That might be needed in that moment. And that's what mental health first aid does. It allows us to be aware, and it allows us to know where the boundary of our responsibility is, right? I can't charge billable hours to listen to my friends, right? And that's not what we're training people to do either. What we are training them to do is to recognize those warning signs, to be willing to move, right? And that's the hard part, because we think we know. We think that we would be willing to engage, but when this crisis might come, it's some scary stuff sometimes, right? And so we need to practice what that means. How would we have a conversation? What would we do? And mental health first aid, youth mental health first aid specifically, gives adults that guidance on how to do that. It gives adults that guidance on how to not give advice. Because, advice is different than support, right? We don't want folks to kind of give information that's not going to be helpful. So where have we gone? Well, I started at National Council 10 years ago, and we had 3 staff members. 1, 2, 3. Trained 70,000 people in 5 years. Great. Maybe less than 1,000 instructors. 10 years later, we have 80 staff members. We've trained nearly 3 million people, and we are in every state across the country and have 26,000 instructors. I give you those numbers because 4 years ago, this conversation was so difficult. We had to beg people to care about things before they happened. And now we're in a position where we've had the reach, and schools are now adopting something called teen mental health first aid. And we've done this with partners. I heard in my bio, oh, she's contributed to 3 million people. Yeah, contributed is a very small, big emphasis there, because I would be very tired if I tried to train 3 million people, just saying. But I want to draw your attention to these numbers because 3 million people sounds like a lot. What's the population of California? Way more than that, right? Right? So really, we are at a place that's an inflection point, I think. We're willing to have these conversations, but we need to be smart about how we have them. And so we have them in a number of different ways. We have them with adults to support other adults. We have them with adults to support youth. And now I am so excited, actually, that we have a program that allows teens to support teens in 10th, 11th, and 12th grade. And oh, by the way, we got to launch it with Lady Gaga. No big deal, right? And so those are the kinds of things that I think is really important to recognize, is that young people's mental health, and we're all here because young people, you all, how you experience things is way different than how adults do. And it's important to have that information because, as was stated yesterday, I was like, oh, they're just going to do my whole presentation? Is that what's going to happen? Look at these numbers, right? Folks are going to more often than not go to a friend than they are to a parent. And these numbers are specific to some research that we've done. And then also, it's about how we give that information. CPR, folks, I saw a lot of you in the room. What's the acronym? What's the acronym for your CPR training? ABC, right? ABCs, and they stand for, I heard somebody say it. A, airway. B, breathe. C, circulate. Okay, great, right? You remember off the top of your head. How many first aiders we have in the room? Folks who have trained in mental health first aid. All right. Hey, y'all. So excited. So go ahead and throw out, what's our acronym for mental health first aid? ALGE. Sounds like pond scum. But it's not. What is it? It stands for what we do to remember the steps, just like the ABCs of CPR. And that's what we have up here, ALGE. It's about how we approach, right? How do we approach somebody and not assess from a clinical perspective, but how do we make sure that a person knows we're there to be supportive, and knows how we want to help, knows that we are looking to help them get to a next step, not that we are looking to fix their problem. And we're also not looking at people as problems, and that's a whole nother conversation, but that's something that we go through. We also look through listening non-judgmentally. How many people are partnered in the room? Have a partner? Mm-hmm. Did you think you were a better listener before you got a partner? Yeah, that was me. And so also it's important to suspend judgment when we're hearing what someone is going through, and not try to insert ourselves. And we really practice how to do that. We also give reassurance and information, and not saying that everything will be fine, right? That is a different statement because we don't know. We give and encourage help in two ways: encouraging self-help and other support strategies, or encouraging professional help if the situation warrants it. And we talk about what situations might warrant it. What is important to remember about mental health first aid is that this 5-step action plan is not linear. You see that assess in the middle, and it's not a clinical assessment. We leave the professionals to all the clinical work because they did the work for that. Blood, sweat, tears, all the things, right? But it really is about making sure that you are aware. Is that situation safe for myself to enter into? Am I in a good place mentally to actually support someone else? We ask all those questions. We make sure that we go through the content and show people how it is that you can quickly come to a place where you need to tag somebody else in the ring. Anybody 80s and beyond? Just look ahead. You don't have to. Right, 80s and before, born in the 80s and before. Remember WWF SmackDown, you tag somebody in the ring, right? You don't have to do it yourself. There is an opportunity to go and find help. The same way we do with first aid, the same way we do with CPR. You say, someone call 911, and you go and do what you can do in that moment. And the same way for mental health first aid. It is not about you having to take that burden as an adult to support. And the reason why I emphasize that is because when we decided to bring teen mental health first aid to the United States, it was all about making sure that young people don't have to shoulder the burden in the same ways that adults can, right? And so we changed the acronym. That ALGE acronym is only for the adult and youth course. We changed it for teen, and we'll talk a little bit about what that looks like. I talked a little bit about the outcomes of mental health first aid, and we are excited about those outcomes across the world, 25 different countries. There are more than 83 studies that have been conducted on mental health first aid, and among them, the outcomes are these that are you see on the screen. It really is about that confidence in acting, of course, the knowledge and the mental health literacy, but it's also about the changing of the attitudes and that stigma, and really the thing that we've seen anecdotally really be impactful as this has been implemented in schools particularly is that increase in referrals to services that might not have otherwise happened. And when those services are available, that is wonderful. What happens when those services are not available, and how do you maintain the support? One of the things that's important about mental health first aid is that we require everyone who is an instructor to provide us a document during that course or as a result after the course that includes those local resources, so that although mental health first aid is run by the National Council for Mental Wellbeing, it is powered by the passion of so many individuals who are local and delivering this content and talking about those local resources, making sure that they're up to date, and it's connected to a network of providers across the country in the sense that those that are local know what those resources are in their backyards. So we also talk a little bit about what the role of a mental health first aider is and kind of the boundaries of that. We express that it's not about diagnostics or treating someone. We make sure we talk about what we see and not what we heard. Like, you know, how many played that game, the whisper down the lane thing, telephone? Anybody play that? Yeah? How's that work out at the end? Not good, right? No bueno. Okay. So observing those changes is really important, but also offering what we talked about in ALGE and making sure that we're respecting that family's privacy, as well as understanding cultural considerations. And so I'm really excited about some of the work that we've done recently to increase our cultural considerations included in the content, in addition to the representation of several communities. I talked about adult, youth, and teen, but we also just released at the end of last year mental health first aid for tribal and indigenous populations in the adult and youth space. And we are going to do that for teen mental health first aid too. So I'm really excited about that. That's been something we've been working on since 2016. I'm really excited. Did you hear me say really? I'm really excited about that. And then also, one of the things that I think is important from a cultural perspective is that law enforcement, fire and EMS, older adults, higher education, in rural communities are areas where we have specified content for those areas, and that portfolio of scenarios and videos and films is growing every day, so we can make sure that mental health first aid resonates. The other way that mental health first aid resonates is making sure that Spanish-speaking populations, that's something that exists for all of our content, it's in Spanish, but also other languages. So this year, for the first time, I'm so excited, we're almost done with translations into Korean, Khmer, and Mandarin. And so we'll continue to do that translation. We'll continue to grow so that we can make sure that there's not just the content, but we're adjusting it to make sure that it's resonant with the communities that are there and it's built with the community, not for someone and giving someone something, but built with those with lived experience and those that are of community. And so really excited and proud of that work. Any instructors in the room? Okay, awesome. How many of you were as scared as I was when I did my teach back on day 3 or day 5 of the training? Yes, okay, good, I'm not alone. Thank you. I say that because even when you're in this field of mental health, becoming an instructor means that you are taking the time to deliver this content, but also there's a weight of responsibility to make sure you feel that you are giving the right information. And we support those instructors, all 26,000, to make sure that they feel comfortable in delivering the course. One of the things I think is important is that there are opportunities to get trained in person or online. For those first aiders, you can go through a 3-day course for instructors. We have the ability for the first aiders to take the course either fully online or in person. And I think another thing that I want to mention is that before 2020, this course was completely in person, right? That is how we deliver the content. I also want to draw your attention to have another conversation. And in light of all that you've heard and all that you know from your field, many of you are professionals in the field, if we had to boil it down to one thing, if we had to boil it down to one conversation, I would love to know, what is that one concept for adults? What's the one concept that you wanted teens to understand about mental health and substance use? And for teens in the room, what is the one concept you wish adults would actually understand about mental health and substance use? You all are the experts. You know what your experiences have been. I would love for you all to have that dialogue at your tables, and then we'll come back together. So let's give another brief conversation at your table around what is that one thing that you wish others understood about mental health and substance use. All right, so I'm not voluntolding anybody. Any volunteers to just give a summary of what you discussed, and what's that one thing? Is there one thing? All right, over there, let me make my way through the middle of the room. All right, threading the needle. Here we go.
Hi, everyone. So we talked about a couple different things for adults versus kids because the table's kind of seen different problems. And we talked a little bit about the idea that kids don't think that going to adults will help. That's one of the big things they don't understand. They're worried about being a snitch or that the adults will make things worse or we don't care. So just empowering them to get that support. And with parents, a lot of it is not understanding just the pressures their kids are under. You've heard a lot from parents this year, like, oh, they're just being dramatic, they're just being lazy, they're whatever, but there's just so much that's happened with, like we talked about yesterday, with the impact of the internet and the pandemic and a bunch of other stuff that it's adding stressors that their parents might not fully be aware of.
What's your name? Travis gave a wonderful summary. Thank you for that, Travis. And really, it's about like those two different perspectives. This is why I asked the adults to think about it from the teen perspective and vice versa, right? So definitely those different perspectives. Okay, one more.
All right. Oh, okay. Hi. So we had two separate.
I'm coming on this side.
Do you want me to hold it? Okay. We had two separate things because we couldn't decide one, but one of them was that one, we can't really find the words to describe what we're feeling. It's like, even if we want to go and talk to someone, it's like, what am I supposed to say? Like, oh, I'm feeling sad, but it's so much more complex than that and so many more emotions. And we also said that we feel like adults should understand, even if we are so young and even if we don't experience something, even the littlest thing can make us go into a whole spiral. And like, even if we don't have the many experiences and we just don't have, like, you know, even if it's just the littlest thing, that experience could like ruin our world in our minds. So like, we don't really appreciate when like adults are like, oh, but you're so young, and like it's just, it doesn't really matter. It's like that our brains just react so much more to those things, and so it makes it 10 times worse. When
Thank you. And what's your name again? Oh, Tristan. Tristan, thank you for saying the collective of what I saw. What you couldn't see is all the teens in the room going like this. Right? And so I love your summary of, hey, just because this wasn't your experience doesn't mean it's not mine. And just because I can see, you can see, like, just because you're older doesn't mean that my experiences aren't valid. And I love that. So thank you, Tristan. One more. I'm looking, I'm scanning. Did somebody have something? Here, it sounds like somebody has a burning thing over here. All right.
Test.
All right.
Test. Here you go.
You got voluntold. I feel for you. It's okay.
You want to do it or not?
I love that. Teamwork makes the dream work.
We basically talked about the difference between validation and support, and kind of worked together as a whole to figure out that it's not one or the other, but teens need both, because you can get validation without feeling supported, and you can get support without the actual validation of the feeling. So as a parent, to really understand that my child needs both validation and support, and to the teen, they look different. And so to have that conversation with your teen about am I supporting you? Am I validating you? What's the difference? So.
Absolutely. I love it. What's your name? Nora, thank you so much, Nora. And thank you for the teen that I saw giving that great information, and for the teamwork that made it come into the room. Can we give a hand to everybody that had something to say? Thank you, Laurie, for your assist. Give a hand for Laurie, the beautiful Laurie who helped us. Absolutely. So I think that it's really interesting, this conversation, and you all have given me such things to think about, conversations that I want to take back today, to help us understand that, just because we know that the 1 in 5 folks who are under the age of 18 in this country are going to experience a mental health challenge, it doesn't mean that that challenge will look the same. Doesn't mean that the challenge will sound the same. The words might not be the same that they use to describe the same kinds of challenges. And I think that's one of the hallmarks that I think helps me when it comes to helping communities figure out how to implement this in ways that really resonate, is that does it really matter which diagnosis it is? Does it really matter that we label it in that way? Or does it matter more that we're having the conversation and allowing teens to say what they need, allowing them to name what they're naming, and hearing them with a lens to not just color it with our own experiences as adults, but also be open to challenging some of our own experiences and thoughts about what we think it means to be mature, or what we think it means to be at a certain age, and what those markers are from a development perspective. So I love some of that challenging of the process. So y'all, I'm just saying, teen mental health first aid is the best thing since sliced bread. And it's the best thing since sliced bread because it's a peer-to-peer program. Not like it takes all of us. I do want to say that every program that exists, it's going to take all of those programs, because everyone and everything is not for everyone. I get that. But the reason why I'm excited is because for the first time, in just the first 8 schools that we implemented teen mental health first aid, more than 11 young people raised their hand and said, I need help, and were considering suicide and decided not to die by suicide. That was just the first 8 schools in the first few months of us rolling this out. Can you even imagine what has happened? Because now we're at 700 sites across the country, and I'm tearing up because the level of impact you as teens are making on your peers, it's keeping people here. And I'm so grateful for that. I'm also grateful because young people are saying, hey, this is how we want to be referred to. This is how we want to talk about these concepts. And we're demanding change in a way that is changing quite literally the landscape of mental health in this country. We're seeing that happen with teen mental health first aid. We're seeing them identify and learn how to maintain that relationship that they have with their friend while they go find a trusted adult, because that is a requirement. We also require any site that wants to become a teen site to take youth mental health first aid. We know that we don't want the adults in the space to not be aware of how to help in ways that work and not have that shared language. And so 10% of the adults in whatever space it is, whether it's a after-school program, a youth-serving organization, 10% of those adults need to be trained in youth mental health first aid to then support teen mental health first aid. And we're seeing school districts. The state of Florida has 80% of their staff who are taking youth mental health first aid. They'll be well positioned to implement teen mental health first aid. We're seeing legislation change that requires mental health and substance use services in schools, but also prevention programs. And this is one of those that is being used. our emphasis is not on teens doing the algae action plan, but there's a different action plan. And the action plan allows them to understand and see what they see, ask their friends how they are, listen and help, but really value that friendship and maintain it even if we're finding that trusted adult to support the situation. One of the things that we also do is make sure that teens understand and see themselves reflected in the content. And so there's a number of films and vignettes of individual teens. There's 6 different ones who we can follow along their journey. Some of them are experiencing challenges as it relates to their mental well-being or substance use or eating disorders. Those are things that we kind of cover in the content. But we do so in a way that allows them to be safe. We want to make sure that there's a safety protocol in all the schools that this is implemented in. And then there's an exit ticket. So after the course, at the end of every session, teens submit anonymously, hey, if I need some help, I'm going to let that person know that I need some help and I want to have a conversation afterward. And so that's required, and that's the safety mechanism. But one of the things I'm excited about also is this pilot of this content. The fact that we were able to get some great data and implement the content. And we saw 88% of the teens use those skills to help after the course, which I think is amazing. And this is just in 3 months after the course, and 67% of them used it to really specifically address stress. So I'm going to close because I want you to do a homework assignment for me. Self-care is paramount, but not in the sense of like bubble baths and like cute and cuddly, animals on the internet. Those things are great, just saying. But self-care is important enough for you to prioritize it for yourselves. And I know the folks in this room care about mental health and care about others. When's the last time you did something for yourself and nobody else? I mean, like buy a lollipop. Not saying something, it could be anything, off the top of your head, things that really resonate for you. Sleeping in, right? We're going to talk about sleep later today. And so many opportunities for you to take a moment and write down something you're going to do for your own well-being, especially you clinicians in the room. I'm looking at you, right? Folks, it's so important to take care of yourselves, and it's so important to have that conversation, and I'll give it as homework, but you are important, and I'm not going to cue Michael Jackson's Man in the Mirror conversation right now, but it really is amazing to be a part of this conference, to be a part of this conversation, and for you all as young people, I appreciate you. I appreciate the fact that you're requiring us to do something different, and I can really see the change you're already making just by being here. Thank you so much for listening to me rant. And if you have questions, I'm around.
Is this on? Yeah. I want to talk for a moment. Okay. This is like in the TED stage when Chris comes out and talks to the speaker, that's the thing. But I want you to know that how many of you have been trained by me in youth mental health first aid? Okay, so think about a ripple effect. She trained me to be an instructor and a rock star at that. And there's another thing I want to tell you, and to the youth in the room. I said this yesterday, but you may not have heard it. The reason we at AIM started really hitting the ground trying to get every adult trained that we possibly could is because that's what you, the youth, told us needed to happen through your surveys. We needed to reestablish and heal the relationships between teaching staff and all the adults, those the adults in their lives during COVID that they didn't have a relationship with, they lost those. We knew we needed to reestablish those. You told us that, the AIM Ideas Lab gave us that information. So we knew that we needed to start with youth mental health first aid and get the adults trained, step one. And now, because what you've told us, AIM Ideas Lab youth researchers, we're starting teen mental health first aid. And we are looking for all of you to get involved with that and support that, and we're gonna roll that out. And it is such an honor to be with you and partner with you to make this happen, because what you did at the National Council brought it here, and now we're going to ripple effect it out. And I do believe that if we can get as many adults trained and teens trained, it will change the future of our country and our world. Thank you.